Hi guys, today we're going to talk about T cells. So T cells are a part of adaptive immunity. They're produced in the bone marrow and then they get matured in the thymus by positive and negative selection. They bind to antigen which are presented only by the MHC, which are encoded by the HLA gene. There are two types of T cells, CD4 and CD8. CD4 are a part of direct immune response and they recognize antigens which are presented by MHC class 2. And CD8, these help in killing virus-infected cells and these bind to antigen by MHC class 1. So let's talk about MHC. There are two types of MHCs, MHC1 and MHC2. MHC1, this comprises of HLA A, B and C. These are present in all cells. They express intracellular antigens which are delivered by TAP in the rough endoplasmic reticulum. Bare lymphocyte syndrome. It is when the TAP is unable to deliver the antigen to the MHC, leading to the defect in the T cell activation. They show an increased susceptibility to infection. So basically, MHC2 comprises of HLA-DR, HLA-DQ and HLA-DP. It is expressed on the dendritic cells, macrophages and B cells, which are antigen-presenting cells. The MHC is bound to the invariant chain in the lysosome. It expresses the exogenous antigen by forming a phagolysosomal complex. The CD4 cells need to be co-stimulated in order to be activated. That is, by binding of the B7 protein on APCs with the CD28 on the T cell. There are two subpopulations of CD4 cells, the Th1 cells and Th2 cells. Th1 cells, these activate macrophages and CD8 cells. They produce IL-2 and interferon gamma. Interferon gamma activates macrophages and these macrophages in turn release TNF-alpha, which promotes granuloma formation. Th2 cells, these release IL-4, IL-5 and IL-10. These also help in B-cell antibody production and they're predominant cells in lepromatous leprosy and ulcerative colitis. CD8 T cells, these are also called as cytotoxic T cells. These kill the virus-infected cells by inserting perforins and granzymes. They also cause apoptosis of the cells by producing Fas ligand, which is an extrinsic pathway of apoptosis. And also they activate caspases. Regulatory T cells, so these are another type of T cells which primarily act by suppressing CD4 and CD8 function. They express CD3, CD25 and FOXP3. They also suppress inflammation by releasing anti-inflammatory cytokines like IL-10 and TGF-beta. IPEX, this is an X-linked syndrome which is due to a defect in FOXP3 in the regulatory T cell. It causes immune dysregulation and it presents with a clinical triad of enteropathy, polyendocrinopathy and dermatitis. Memory T cells. So these are formed during the primary exposure of the antigen and then they get activated during the secondary exposure, producing more cytokines requiring less antigen for a faster and more vigorous response. So example for the memory T cell response is the PPD test of TB. So if the patient has prior exposure to TB, then the memory T cells will activate and secrete interferon gamma, which results in skin reaction like swelling. Super antigens cause toxic shock syndrome. By massive T cell response and increased release of cytokines, this results in vasodilatation and shock. Th17 cells. These are a subset of CD4 cells that are important for mucosal immunity by producing IL-17. Loss of these cells lead to increased susceptibility to sepsis by gut bacteria. IL-12 receptor defect. This prevents the differentiation of T cells to Th1 cells, increasing the susceptibility to dissemination of TB, salmonella infection, and increased risk of TB after a BCG vaccination. And it can be treated by interferon gamma. That's the end of this video. Thank you for watching.